Chapter 10, Calculation of Injectable Doses. So we have our keywords at the top, which you should definitely take a look at. They will be talked about in other chapters in the program, but it's always nice to make yourself aware of these things while you're learning about how to calculate the dosage. All right, so we have the pretest for the chapter. If you're comfortable with the subject matter, perform the following calculations to test your knowledge. Obviously, if you're new to math and this program, you're probably not going to be able to go through those and just do them on your own yet. So that's totally fine. Don't let that discourage you. We're just going to skip over that right now. But this is a good tool to test yourself on as we learn this information. Parenteral medications technically include anything administered outside of the gastrointestinal tract, but they're also commonly considered to be those given by injection or infusion. So they're commonly administered directly within the bloodstream, intravenous, within the muscle, intramuscular, under the skin, subcutaneous, or within the skin, intradermal. With the exception of slow release injectable medications, which are never given intravenously, injectable medications have a quicker onset of action than oral medications. They may be considered if a person is unable to swallow solid medications, if a quick effect is needed, if a person is combative, or if the particular medication would be degraded, broken down by stomach acid before it has a chance to exert an effect on the body. So that's really important to talk about. Um, a lot of people ask me and have asked me throughout the years, why can't insulin just be taken as a pill? Why does it have to be injected? Because the insulin would be degraded by stomach acid before it would work. So that is 100% why it has to be injected. I think there's a nasal insulin available out there. It's really expensive and not very common, but other than that, there's no other forms for insulin. And that's the same with a lot of injectable medications. Most injectable medications are supplied in ampules or vials and are prepared as a liquid, either in an aqueous water or occasionally in oil base by the drug manufacturer. Some medications, especially those used for cardiac emergencies, are supplied as pre-filled syringes from the manufacturer. Medications that are not stable in the liquid form come in powders that must be reconstituted before administration. These medications are not stable in liquid form for an extended period of time, so stability must be considered at the time of reconstitution and administration. As with oral liquid medications, most strengths of parenteral medications are identified by weight of medication in a specific volume of liquid. The weight is usually provided in the metric system, so milligrams, grams, or micrograms, and the volume in liters. Electrolytes are typically measured in milliequivalents per ml. The apothecary system unit of grains per milliliter can also be used. So something you'll definitely need to get used to is looking at the strengths of medications on all medication bottles. These are really hard to see, but you can see here it says 500 milligrams. So this vial is 500 milligrams. And it should have the strength listed per ml. Like you can see here, kind of. It's really hard to read it, but it's right here. Looks like 1,000 or 100 units per ml. And you'll see that on all these bottles. International units are used for biologic medications. Some parenteral medication strengths are expressed as a percentage or ratio, but these are often expressed on the manufacturer's label in weight per volume strength as well. Because all injectable medications must be prepared using sterile technique, sterile needles and syringes must be used. Pharmacy staff uses syringes ranging from 1 to 60 milliliter when preparing injectable medications. TB syringes have a 1 ml capacity and are calibrated in 0.01 ml increments. 3 ml syringes are calibrated in 0.1 ml increments. 5 ml and 10 ml syringes are calibrated in 0.2 ml increments, and 20 ml syringes are calibrated in 1 ml increments. 60 ml syringes are calibrated in 2 ml increments. Once the dose has been calculated, the correct syringe must be chosen based on the amount of medication to be administered or added to other intravenous fluids. If the volume of a medication dose is less than 1 ml, it should be measured with a 1 ml TB syringe, except in the case of insulin U100, which is measured in specially calibrated insulin syringes. Doses less than 1 ml that require rounding are rounded to the hundredths place because that is a measurable on a TB syringe. A 3 ml syringe is the usual choice for measuring volumes between 1 ml and 3 ml, which would be rounded to the tenths position if necessary. A 5 ml syringe is used for doses between 3 ml and 5 ml, and a 10 ml syringe is used for doses between 5 ml and 10 ml. These doses should also be rounded to the tenths position if necessary. A 20 ml syringe is generally used when measuring medication to be added to a larger bag of IV fluid or for an IV push. Injectable medications may be prepared for direct administration to a patient or for addition to IV bags. Some medications must be further diluted to be safely administered to a patient. So just a little note, large syringes are seldom used for medication administration, other for an IV push or use in a syringe pump, but are frequently used in the preparation of IV fluids. The accuracy of measurement of medications decreases as the syringe size increases. The selection of the correct syringe depends on the volume of medication and the precision needed. The liquid volume in a syringe is measured from the top ring of the plunger, not the raised portion in the middle. The 10 ml syringe is pulled back to the 4.8 mark in this picture, and the 5 ml to the 3.1 ml position. And then the next picture indicates 1.7 ml. And the picture on the next page is the 2.3 ml. So we have some practice problems. We're just going to skip over those for right now. Injectable medications are provided in vials or ampules. Some are also supplied in pre-filled syringes. Ampules are sealed glass containers which may only be used once because there is no way to ensure sterility after they have been opened. The use of a filter needle is required when withdrawing medication from ampules in case any glass shards enter the product when it's opened. The filter needle must be replaced with a regular needle before the medication is administered. Vials have rubber stoppers. Multiple dose vials contain preservatives so they can be used again, whereas single dose vials do not. Single dose vials and ampules are slightly overfilled, but the concentration is as written on the label. Powders for reconstitution are supplied in multi-dose or single dose vials or in active vials. This is an active vial here. Most sterile liquids used for reconstitution are also supplied in vials. When calculating injectable medications, it is important to know the appropriate volumes for the various routes of administration. The intradermal injection limit is 0.1 ml. Medications given subcutaneously are usually less than 1 ml, but may go as high as 2 ml in some instances. Small volume intramuscular injections should be less than 3 ml, but intramuscular injections into larger muscles can go up to 5 ml. If your calculations do not yield an answer within these parameters, there is most likely an error in your calculations or the prescribed amount. The rules for calculating injectable doses are the same as those for oral liquid medications. The same formulas are used and the calculations are the same. However, the dose volume is generally smaller. If more than one strength of medication is available, the strength that requires the smallest volume of medication to be administered per dose should be chosen for subcutaneous or IM dosing unless the medication is available in a strength that provides the dose to an exact marking on a syringe. All right, so let's dive right into example 10.1. All right, so example 10.1, we have a medication order for Tagamet cimetidine, 75 milligrams IM every 6 hours. In stock, we have cimetidine injection, 300 milligrams per 2 ml, and an 8 ml, a multi-dose vial. Our order is Tagamet 75 milligram intramuscularly every 6 hours interpreted. So when you're interpreting orders, you're going to just say for medication orders, you're going to just say the name of the drug and translate any SIG codes in there. And what volume of medication is needed for a single dose? So we are going to do a proportion, of course, and we're going to use the strength of the medication on one side, which is how a lot of these problems, if not most of them, are going to be. 300 milligrams over 2 ml. And then we want to have the same units on top as we have on the other side, and same with the bottom. So we know that our units are going to be milligrams over milliliter. And we have the order for 75 milligram. I'm going to place that here. And we want to know how many milliliter that's going to be. That's how much we are going to draw up in the syringe for the order. So it's important to find that out. So to solve, we're going to do our cross multiplying. So 300x, and then that is equal to 75 times 2. So I'm going to solve the side over here where I have multiplication. So 75 times 2. You can use your calculator and you'll find out that's 150. And I'm just going to rewrite 300x. All right, now I want to solve for x. That's what I'm trying to find out, how many milliliters. So I want to get that alone. So to do that, I have to divide this side by that number, 300. And then I also need to do it on this side as well. So I want to do it to both sides. And over here, all we have left is x. And then if we get out our calculator, and do 150 divided by 300, we get 0.5 ml. That is how much we would need to draw up for a single dose. Now it's asking, what is the appropriate size syringe for administering this dose? And the answer is there. It's a 1 ml TB syringe. And that is the smallest syringe that we have and one that we would want to use for that. Example 10.2, we have an order aminophylline, 125 milligrams IV every 6 hours. And you can see that the label is right there. And we need to find out what volume of medication is needed for a single dose. So it tells us that the medication is 25 milligrams per ml. So just like in the other example, that's what we're going to start with, the strength of the medication. And we need to give the patient 125 milligrams. How many ml is that? So 25x is equal to 125 times 1, which is 125. We want to get 25, we want to get rid of 25 so we can get x alone. And then we're going to divide that side by 25 as well. And then we're going to take out calculators and do 125 divided by 25, which is 5 ml. So I got that 25 milligram per milliliter right here. That is the strength of the medication. The vial is 500 milligrams over 20 ml. So if you would have used that, you still would have gotten the right answer. That is the lowest terms. There would have just been different math involved, but you still would have got the same answer. Some injectable doses require rounding to a measurable quantity. If an injectable dose is less than 1 ml, it should be rounded to the nearest hundredth. Once rounded, the dose should generally be within a 10% margin. Some medications require rounding to be within a much lower percentage of variation. This is due to the narrow therapeutic range between effectiveness and toxicity levels. Insulin, heparin, and penicillin are measured in international units. Other less common medications that are measured in units include fat-soluble vitamin E, some forms of vitamins A and D, and the topical antibiotic bacitracin. With injectable medications, the labels display the specific number of units per milliliter. Units are not interchangeable between different medications. Rather, each medication unit is specific to the drug ordered and represents a standard amount of that particular medication that produces a desired biologic effect. Insulin and heparin are considered high alert medications on the ISMP list of high alert medications. Another high alert medication is potassium chloride injection, which is measured in milliequivalents. An international unit measurement gives information concerning the strength of medication in a given drug form, such as volume for liquids. A conversion factor is not used because an international unit is a factor specific to the strength of each particular medication. The medication label provides information on the strength of the medication, such as insulin or heparin. These are similar to medication strengths found in the metric system, such as milligrams per milliliter. Most important for a pharmacy technician is to be aware of the volume of the medication and the strength for the dose as listed on medication labels. As with all medication calculations, reading a drug label accurately is of utmost importance. It is the basis for correct preparation and administration of medication. Insulin is used to control type 1 diabetes mellitus and some stages of type 2 diabetes mellitus. The most common insulin strength is U100, meaning that each milliliter of insulin contains 100 units of medication. So, as a pharmacy technician, this piece of information that I just said, the most common strength of insulin is U100, meaning that there's 100 units of medication per milliliter. That is something that you want to make a nice comfy spot in your brain because you're going to need to know that for the rest of your life every day. Table 10.1 shows the approximate action of common insulin preparations. So we have rapid acting insulin. So the brand names that are book list, there's might be more since the book's been published, but Pedra, Humalog, and Novolog. The short-acting regular insulins are Humulin R and Novolin R. The intermediate-acting NPH insulins are Humulin N and Novolin N. Long-acting are Lantus and Levemir. Ultra-long-acting is Tresiba. Combination insulins are Humulin 50/50, Humulin 70/30, and Novolin 70/30. Those are MPH-R combinations. MPH Aspart, Novolog 70/30, and MPH Lispro, Humalog 75/25. And then it also lists the onset. So the onset is when the medication starts working after it's been injected. So for the rapid acting, 15 minutes later. For the short acting, 30 minutes later. For intermediate acting, 2 to 4 hours later. For long acting, 1 to 2 for Lantus and 1 to 3 for Levemir. For the ultra long acting, 1 hour. And then for the combinations, we have 30 minutes for MPHR Humulin 50/50, 30 to 60 for Humulin 70/30, 30 to 60 for Novolin 70/30, and then Novolog 70/30 and Humalog 75/25 are at 15 minutes. The peak for the medication, so when it is working at its best. So for the rapid acting, it's 1 hour. For the short acting, it's 2 to 3 hours. For the intermediate acting, it's 4 to 12. For long acting, there's no peak considered, meaning it's working the same the whole entire time. Same with ultra long acting. And then these time ranges here for the combinations. The duration, so how long is it going to work in the body? For rapid acting is 2 to 4. Short acting 3 to 6. Intermediate 12 to 18. Long acting 24 hours. So that's usually why that is only given once a day. And usually it's given at night. Ultra long acting is up to 42 hours or more. So usually with Tresiba, they don't inject as much as they would or as often as the other insulin. And then this time for the combination. U100 insulin syringes are used to administer U100 insulin from these bottles. No other syringe is based in units for U100 insulin. The design of the syringe helps ensure that the exact dose of medication is administered. Most insulin is available in pre-filled insulin syringes as well to help avoid dosing errors. Insulin preparations are labeled according to type. Each formulation has a specific onset, peak, and duration of action. So going back to that table we just went over. An abbreviation of R for regular insulin, a clear solution indicates that the medication is short acting. An abbreviation of N for MPH insulin, a cloudy suspension indicates that it is intermediate acting insulin with a slower onset and longer duration of action. Manufacturers have placed large letters on these two types of vials, emphasizing the exact type of insulin. Other preparations include combinations of regular insulin and intermediate acting insulin and long acting insulin. Insulin syringes for U100 insulin come in 30 unit, 50 unit, and 100 unit sizes. Some of the 100 unit insulin syringes are marked in 2 unit increments, whereas others are marked in 1 unit increments, with 2 unit increments of odd even on each side of the syringe barrel. Note that 30 unit and 50 unit insulin syringes are calibrated in 1 unit increments and are therefore easier to see for patients with vision problems, a common complication of long-term or uncontrolled diabetes mellitus. All U100 insulin contains 100 units per ml. U100 insulin syringes are designed for this strength. A dose of 30 units or less should be measured in a 30 unit syringe, 31 to 50 units in a 50 unit syringe, and 51 to 100 in a 100 unit syringe for the greatest accuracy. These syringes should not be used for measuring any medication other than U100 insulin. All insulin formulations can be administered subcutaneously. Only regular insulin is indicated for IV use. When mixing a clear, short, or rapid acting solution in a cloudy, longer acting suspension in one syringe for subcutaneous administration, the rule is to draw up clear insulin before cloudy insulin So regular insulin must be drawn up in a syringe before NPH, which is a suspension. If different types of insulins need to be administered at the same time, the same source of the insulin, such as DNA or recombinant sources, must be used together. Different sources of insulin cannot be mixed in the same syringes. Lantus and Levemir, two long-acting insulins, can never be mixed with any other type of insulin. All right, so let's jump into these examples, example 10.3 and 10.4. Example 10.3, a physician orders 10 ml of Humulin N U100, 12 units TID PC for an elderly patient. What should the technician supply for the administration of this medication? So we are going to provide 30 unit insulin syringes because the dose is less than 30 units. Mm. And we don't have to do any math for this problem. We just were figuring out the best syringe to use. Example 10.4, a physician orders Humulin 70/30 40 units QAM. Which U100 syringe should be used to administer this medication? So remember that we have 30 unit, 50 unit, and 100 unit syringes, or insulin syringes, I should say. So obviously, if we were going to give the patient 40 units, we wouldn't give them a 30 unit syringe because that wouldn't be enough. And we wouldn't want to give them 100 because it would be harder to measure the quantity accurately. So we would choose the 50 unit syringe. And 70/30, again, remember it means that each dose contains 70% of it is NPH insulin and 30% of it is regular insulin. How many units of NPH insulin would be received per dose? So the amount that they're doing is 40 units. We already know that. And yes, we have the answer right here, but I'm gonna show you how we get that answer. So we have 40 units. So a lot of people would see that question and they would just be like, well, we're giving them 40 units. But we want to know like how much they're getting based on the percent of the strength of the insulin. So we're going to take that percent, we're going to turn it into a decimal. So to do that, I would just rewrite it 70 over 100 and 30 over 100. And then I get out my calculator and do 70 divided by 100, which gives me 0.7. And then again, if I do 30 divided by 100, I'm going to get 0.3. So then I'm just going to take those 40 units like they did and multiply it by these numbers. So first I would do to find out how much is in the 70%. I would do 40 times 0.7, which they've already figured out for us is 25 or 28 units, sorry. And then for the 30%, I would do 40 times 0.3, which would give me 12 units. So yes, they're taking 40 units, but technically 28 of those units are 70%, which is NPH insulin, and 12 units are of the 30% regular insulin. There are some more concentrated insulin products as well, such as U200, U300, and U500. These products are 2, 3, and 5 times as strong as U100 insulin. containing 200 units per ml, 300 units per ml, and 500 units per ml, respectively. This has added to the potential risk for errors. The ISMP recommends that in a hospital setting, U500 insulin should be dispensed from the pharmacy and patient-specific labeled pen devices or patient-specific pharmacy-prepared U500 syringes. Insulin U500 syringes hold up to 250 units and are specific for U500 insulin. Unlike U100 insulin products, which are stored on some nursing floors, U500 insulin vials and syringes are only stored in the pharmacy. Other concentrated insulin products should be dispensed to the floor in patient-specific labeled pen devices. Extreme care should be taken to verify the correct type and strength of insulin dispensed. And this is just kind of a little bit on the different higher concentration insulins. All right, so now we're at practice problem C, which we're just going to skip over for now. Heparin is an injectable anticoagulant medication that is measured in units. Heparin may be used as a flush for an IV injection site to keep it in, as an IV infusion additive, or as a deep subcutaneous injection into fatty tissue. The doses for heparin are highly individualized based on body weight and blood coagulation laboratory values. Because heparin prolongs bleeding time, the time that it takes for blood to clot, accurate dosing is one of the most important. A dose that is larger than necessary may cause hemorrhage, whereas a dose that is insufficient may not produce the necessary results to prevent clot formation and possible thrombi, which are blood clots. Heparin is available in 10 units per ml, a pediatric heparin lock flush, 100 units per ml, a heparin lock flush, 1,000 units per ml, 5,000 units per ml, 10,000 units per ml, and 20,000 units per ml. It is essential to pay close attention to the strength of heparin chosen to provide the correct dose. Heparin doses should be measured using 1 ml tuberculin syringes for the greatest accuracy. Because no conversion factors are needed with unit calculations, they are performed easily with ratio and proportions. And then DA can be used. However, just a reminder, we don't teach that in this program. So if you understand dimensional analysis and figuring out these problems, then that's awesome. And I hope you get the right answers. But through our lectures and in the program, we'll be using only ratio and proportion. So heparin is never administered intramuscularly because of the danger of bleeding into the muscle tissue. It is given subcutaneously and by IV infusion. I just wanted to throw that in there. So some low molecular weight heparins, such as Fragmin, are also measured in units, although some, such as Lovenox, are measured on a milligram basis. The low molecular weight heparins do not have this short half-life of heparin, but they also primarily are administered subcutaneously. All right, so let's do example 10.5. Example 10.5, a physician orders heparin sodium 2,500 units subcutaneously stat. The medication is available in heparin sodium 5,000 units per ml. How much should be administered? So just like the other practice problems and examples we've done, we're gonna, of course, take the strength of the medication and place it on one side of a proportion. And then I know that I need to have units on top and milliliter on bottom. I'm looking for how much to give the patient in milliliters to complete the order. So I will place my 2,500 here. And then I will do 5,000x is equal to 2,500 times 1. We're going to get rid of this over here first. 2,500 times 1 is 2,500. We want to get x alone, so we need to divide this side by 5,000. So that cancels out, and I just have x over here. Then I also need to divide this side by 5,000. So 2,500 divided by 5,000 means that we need to give 0.5. Example 10.6 says the order is heparin sodium 4,500 units subcutaneously, and we're trying to find out what volume is needed, like we are in all the other problems. This one is just saying using all of the following stock strengths because heparin comes in many different strengths. So sometimes you might have to calculate the best dose to use. In this example, though, we can see that they have set these all up as proportions, just like we have. So right here, we have all the different strengths of the medication. So it comes in 1,000 units per ml, 5,000 units per ml, 10,000 units per ml, and then 20,000 units per ml. So on a proportion, on each side of a proportion, they have put that, just like I've done. And then on the other side, of course, they match up the units across, and every single one of them, we're trying to find out how many milliliters it would be to give them 4,500 units. So which one would we choose for the order? What would be the best choice? So usually it is the smallest amount is the best choice, but if we had to measure out this 0.225 ml, we would have to round to the measurable dose of 0.23 ml on a syringe. And that would actually be 4,600 units. So the patient would be getting 1,000 units extra that is not needed. So the best choice would be to do the 0.45 ml dose, which is larger in volume, but it is an exact dose. Pharmacy technicians are now assisting pharmacists with vaccinations by helping to prepare vaccines in our community and health system pharmacies. Only a few states allow technicians to administer the vaccines, but this number should increase over time. But yeah, I definitely see this increasing very heavily. Obviously, I think this textbook was done after COVID, but I'm not entirely sure. I have to look at the dates, but um, so probably even since COVID, it's a way higher. So it's kind of another thing that is pushing the realms of pharmacy technician into a career instead of just a job. So love it. Um, Parenteral medications that are unstable in liquid form for extended periods of time are manufactured in a powdered form for reconstitution before use. Most labels state that the total quantity of drug in the container, the volume and type of diluent to use to attain the desired strength, the final strength of the medication after reconstitution, and the stability and storage requirements both before and after reconstitution. Sometimes the package insert may need to be consulted for some of this information. To reconstitute a medication, follow the directions on the medication label and package insert exactly. For using the powdered medication must be completely dissolved into the diluent. Some injectable powders are manufactured with the diluent in the powder in two separate chambers, such as hydrocortisone sodium succinate. This particular system is called the actovial system. When the plunger is pushed down, the diluent drops from the upper chamber into the lower chamber, which contains the medication. With injectable medications, the manufacturer may recommend the use of either sterile water for injection or sterile normal saline. Some drugs may require bacteriostatic water for intramuscular injections or even require a specific diluent, such as those with a small amount of anesthetic to prevent discomfort with IM administration. When a special diluent is necessary, this diluent may be packaged separately and supplied with the medication, as with some vaccines. If the solution for reconstitution is not indicated, consult a drug reference. Remember that the final volume of medication in the container will always be greater than the amount of diluent added because of powder volume. Once the appropriate diluent has been identified, the amount of diluent for the desired dose must be verified. Vials of some multi-dose parenteral drugs may be diluted with different volumes of diluent to attain different concentrations for different routes of administration. Always check the possible concentration or strengths for reconstitution because the desired diluent volume must match the intended route of administration. Decide on the amount of diluent to add and then reconstitute. All right, and then some tech alerts. So never assume the directions are the same as previously found on the same medication. Read the label directions every time medication is reconstituted. The less diluent added, the more concentrated the medication. When reconstituting medications with multiple strengths possible, choose the strength closest to the physician's order that will provide a dose appropriate for the intended route of administration with the least chance of error. All right, so in the figure 10.11, which is on the next page, kind of shows the whole process. The label reads to add 2.7 ml of sterile water for injection. After injecting diluent, the mixing process for an injectable medication is accomplished by inverting the container slowly unless otherwise indicated by the manufacturer. Shaking the container may decrease the effectiveness of some medications and may cause the liquid to foam, which will make it difficult to withdraw the correct amount of medication. Note the length of time that the medication is stable and the directions for storage both before and after reconstitution. In figure 10.1, the directions for storage read discard solutions after 3 days at room temperature or 7 days under refrigeration. After a powder is reconstituted, the person who reconstituted it should write the following on the label if it is to be used again. Their initials, the date and time prepared, the beyond use date and time, the strength to which it is reconstituted. And then here's just kind of a little graphic picture to show you exactly how that process is done. All right, in example 10.7, we have the medication Pfizer pen, which is penicillin G potassium. And it's just going to have us read the medication. First, it's just going to have us read the oops, the medication label. So it says, what is the total dosage found in the container? And it's 20 million units, or written out as 20 million units. That's how much is in the container. If 75 ml of diluent is added to the container, what is the strength per ml? Well, we talked about how it's important to make sure you always read the medication label before you reconstitute anything. So right here, it tells you exactly what the strength would be after reconstitution. So if we added 75 ml of diluent, we would have, and this is right here on the approximate units per ml of solution, we'd have 250,000 units per ml. If we added the 11.5, we would have the 1 million units per ml. It doesn't ask this question, but it's what is the, if we did the 33 ml, it would be the 500,000 units per ml. It says, what is the route of administration? So on here, it says for intravenous infusion only. What diluent is needed for reconstitution? And it doesn't say, so it says that we should look at the accompanying prescribing information. So that's going to be the little white thing on the bottle. And how long is the medication stable in the refrigerator after reconstitution? And it tells us that we should discard the unused solution after 7 days. And then the next part wants to know if we reconstituted to 250,000 units per ml, how many milliliters are needed for a dose of 375,000 units. So looking at this example here, we have done what I've done in all the other problems with taking the strength of the medication, which is 250,000 units per ml. And I always write out 1, 2. I don't just leave ml because it's a little hard for my brain to understand. And then you are placing the strength that you need, the 375,000 units on the other side, and solving for X like we've done in all the other problems. And then the next part, it's just asking if we did it to the 1 million units, how many milliliters would we need for that? And that would be 2.5 ml, figuring that out the same way. Calculations with injectable medications can be performed with ratio and proportion or dimensional analysis for single-step calculations, and if you want to use DA for multi-step calculations. Parenteral medications are supplied in single-dose vials, multi-dose vials, ampules, and pre-filled syringes. Insulin, anticoagulants, and some antimicrobial agents are supplied in units per milliliter. Insulin products are available in a variety of types, mainly in U100 strength. Heparin is supplied in a wide variety of strengths. Read the label in physician's order carefully with both products to prepare the medication that has been ordered for administration in the proper strength and dosage. Reconstitution is necessary when a medication is provided in powdered form due to instability in a liquid form. When medications are prepared for injectable routes, the required diluent may be sterile water for injection, bacteriostatic water for injection, 0.9% sodium chloride, which is normal saline, or a special solution provided with the medication by the manufacturer. After reconstitution, parenteral medications require special storage conditions and beyond use states due to the instability of the liquid formulations. Some medications can be diluted to different strengths or concentrations or as directed by the manufacturers, whereas others have only one dilution strength option. Always read directions carefully before preparing injectable products. And then we have the necessary steps again for how to do the reconstitution. And then you have a post test here. And that is the end of the chapter. So just a few reminders. Um, in this book, there are lots of ways to practice and give yourself some tests, which is really nice for math. So, of course, you have your homework on Canvas and your quizzes on Canvas that you have to do, and you can do those multiple times if you wanted to, but also just for your own sake and for when you're testing for the PTCB exam, come back to these chapters and do the post test, do the practice problems, do the pre-test. And if you need the answers, just reach out to me because I have them. All right.